All right, guys. Hey, welcome to the show. Today we have a guest that he and I go way back. He is a chiropractor, went to school with him, and we were roommates for 4 years, so we know each other very well. We know our habits, our pros, our cons, and we have quite a different background. I grew up mainly in a city atmosphere. He grew up in a very small town. One of the running jokes that I like to say about Bill's upbringing is that he grew up in a town of 5 people, but he has 7 brothers. And that joke never gets old. It just never gets old. So the math on that doesn't make any sense. But he's a chiropractor and has kind of a farm. Now, he grew up a farm boy. I believe there were 5 brothers and a sister, if I have that right, to be honest with you. And, he is, and in one sense, a very classic farm boy. He's twice the strength of most human beings.
Right.
He probably be an inch taller if he didn't have to pick up giant rocks and toss pigs around. It was a real experience getting to know him. When I first met him, I asked him a few questions, and one of them was, has he ever sat up on a horse and directed a cow around? And he looked at me like, directed a cow? Like, what kind of language is that? And I realized that that wasn't the right way of saying it. But I was just trying to figure out, is this guy a cowboy? Or, what is he? And he looked at me like, yeah, I've done that. Like it wasn't any big deal. I had 2 horseback riding experiences. Both of them were horrifying. It seems like horses seem to figure me out, and I don't know what's going on in their heads. I had heard they have the mentality of a 9-year-old, and what do they weigh, 5,000 pounds or something? So a 5,000-pound 9-year-old that can toss me through the air, the whole experience just sounds like a bad idea. And for me, it always was. I should get back up on the horse, I guess, right? That's the old saying, get back on the horse. I've yet to do that, but my kids want to go horseback riding soon. So I'll make sure I bring a camera so I can make sure Bill gets a good experience of that. But Bill has his own hobby farm. And by New York standards, I would call it a fully functioning, self-maintaining, you could probably feed a commune with the stuff he's got growing out there. And he's a guy that pretty much gets it done. I don't know if he even owns a television outside of Andy Griffith shows and John Wayne films. I don't know if he's seen anything else, but he's going to share with us today some of the things about being a chiropractor in a small town, some of the things we know about soil versus dirt, which I think is an interesting topic, and get into some of the more interesting things about why he chose to be a chiropractor and do the farming sort of at the same time. So welcome to the show, Dr. Bill, or well, let's call him Dr. William Cecil, his middle name, Mettler. It's a great name like that. You got to use it. I can't leave that out. It's one of my favorite middle names.
Not many people know that.
Yeah, well, exactly. There's a few things I know about you that not too many people know, and vice versa. Vice versa. Well, welcome to the show, Bill. Thanks for stopping out and seeing us here. But give us a brief synopsis of your, first off, let's start with, why you became a chiropractor.
First of all, maybe a little more about our history. I mean, we go way back. So we were roommates in chiropractic school. That's where we met, right?
Yeah.
And you educated me on the city life because I was kind of fresh from the farm. You kept me from going through those red lights, stuff like that. You taught me about red light, green light, yellow light, right?
Yeah. Yeah. Lane changing, how to change lanes.
Yeah. Yeah.
Look out for other cars. There are other cars you might have to look out for. Yeah, you're a little nervous in the city.
Yeah, stuff like that. But then, you practiced in Minnesota for a while. So, and then we try to get together every now and then, either at when you come back to Minnesota, visit your wife's family, and our mountain trips.
Yeah, I think something to know is that Bill and I always get involved in challenging ourselves. And we have been on this mission to climb as many 14,000-foot peaks in Colorado. He's my partner in crime. I think his wife enjoys me going along with him because I'm the saner of the two. So I'm going to keep him from doing things like going to the top of the highest Colorado Rocky, blowing up a tube, and tubing down the side of the mountain, and then doing a somersault, losing his camera, only to find out that somebody found his camera and delivered it back to him about a month later.
I forgot about that.
it's a kind of fortunate life you live. You lose a camera on the side of a mountain in the winter, in the snow, and somebody finds it and delivers it to you. Well, you were smart enough to go to the bottom and say, I lost my camera on that registry, I guess it would be called.
Yeah.
And you had your phone number. The guy found it, called you, and we got the film back, and we developed the film, which is, kind of absolutely ridiculous. But, Bill and I have got ourselves in a lot of different predicaments over the years, and it's been a great friendship. We challenge each other. We're currently in a chin-up contest. The first one to get to 20 chin-ups wins. Bill was doing really well until he started, I don't know if you were selling pies and he ate half of them, but he kind of fattened up. He fattened up, and it became a little tougher for him to do them. He's naturally stronger than me, the farm boy thing. What are you going to do? Well, I could out sprint you, but forget it after that. But anyway, so it's been a long relationship where we just we're the best of friends, and so I love having him on this show today. And I want all my city people to understand the difference in kind of a country chiropractor. He has a farm that has hundreds of chickens, cows, pigs, horses, and I think a zebra and a giraffe, maybe a unicorn. But he has, and he's feeding his family with this thing. And it's an amazing thing to grow those kind of crops, raise this kind of animals. He has fruit trees, and he's making it all work. And at one point, I know you were thinking of putting together a consulting business for people to get the basic idea of how to run something like that. And I think you should put that together. I don't know if you were saying it's still in its fruition. But anyway, welcome to the show, Bill. Tell us about you becoming a chiropractor. Let's get into that a little bit.
I'll do that. And Mike, I want to thank you for all those years of friendship. You've been a great friend all those years.
Absolutely.
And
mutual.
And an inspiration to me on a lot of different levels. Your dedication to the profession, your dedication to keep learning, dedication to keep pushing yourself. You're a good family man. I've always learned so much from you every time I talk to you, and I appreciate all those years that you've been my friend. So thank you.
Awesome. Thank you. Mutual.
I got so many ideas going through my head when you're talking there. As far as how I got going on the chiropractic, it was research. I was going to be an electrician when I got out of high school. That lasted a week. I went to college. Then I was going to be an electrical engineer. Then I was going to be a genetic engineer. Then I went to seminary. Then I came back, and then I went. Then I decided. Then I was thinking healthcare, something in healthcare. Then I was like, well, physical therapy, chiropractic, medical doctor, what? And the chiropractic fit my personality, fit what I could research about it. And granted, I didn't know a lot, but it was just the best fit for me. And you never know for sure until you get into it. But
sure.
It's been a real blessing. Chiropractic's been a perfect fit for me. I like going to work. I like working on people. It's been great.
Yeah, I think it's for a lot of people, being a chiropractic patient versus being a chiropractor can be a very different experience. You could love being adjusted, but to be able to do it and want to do that and hold that kind of thing, as your profession can vary from one person to another. I think we've all had people that we've sent to chiropractic college or that followed us around, and I'm always like, if you want to be a chiropractor, I hope you like fixing broken stuff. Right. When I was a kid, I liked fixing broken things. If the dishwasher broke, I took it apart. I like I want to know how things work. I like to solve the mysteries of how things work. And there's nothing more challenging than the human body to figure out how that works. You add the emotional overlay into the organs, which we'll talk about a little bit today. And it's just an amazing, never ending, fascinating challenge to get people on the road to healing, and, right. You're a natural at that. We were talking earlier about how a practitioner has to get inside their patient's head, and as a chiropractor versus a medical doctor, I think you have a lot of different. It's a very different experience. Medical physicians have a shorter time frame, right, to get to know their patients. We have those multiple visits, right? We can go over and over, and we get multiple looks. And sometimes what a person tells you on the first visit, you're gonna hear more on the second visit. And I got an example that I had a patient that he came in and said he hadn't had any surgeries. And I thought, well, that's fantastic. He was in his late 60s, I believe. he took his shirt off to start the exam, and he had a zipper on his chest and a scar. And I realized, that's not from getting stuck on a fence. That's a surgery. That's an open heart surgery. So he got into all about that. And I said, any other surgeries I should know about? And we laughed about it. And he was thinking I maybe just paid attention to the spine, and that maybe that was all I need to hear about. Or maybe he had such a great result in that surgery that he did fine and just kind of forgot about it. But, we have that experience, but so get into a little bit about the fact that you have this sort of, would you call it a hobby farm? What would you say is going on there?
Yeah, I guess I don't refer to it as a hobby farm, but it essentially is. It's not really the way we make a living at this point. We make a living with the chiropractor. My wife is a chiropractor also. Mm-hmm. Dr. Christie, she works at the office there too. A little bit about the farm. We got 40 acres, 20 some acres tillable, some woods, some pasture. And we raise a lot of poultry, but we also, the summer we had a couple pigs, we had some beef, we're planning on getting a milk cow. We actually have the milk cow, we just got to get her grown up. We have ducks, chickens, guineas, geese, turkeys. I think that's it.
Nice.
Couple rabbits.
Okay. Now, how many chickens do you have?
Right, and this is our kind of where we have the few. We only have about 70, but in a week's time, I got somebody hatching out for me. I'm hatching out a few, and I got some ordered. So that'll double easily. Actually, that'll triple in about a week. We're gonna get about 140 more, 150 more.
That seems like an insane number for me because, I don't know. I couldn't know less about farming. Everything I know, I've learned from you. My brother-in-law, grows sugar beets in a very corporate type of farm. And it's fascinating how the business of that works. And I've learned a little bit from him, but it's very different than the style that you're involved in. What you're involved in is very much the type of farm that went on for, thousands of years. It's really a natural farm. We've talked about soil versus dirt. And I didn't know kind of what the difference was. And I guess maybe you can expand on that, but soil is very much alive and dirt maybe is less alive.
Yeah, that's the way I think of it. Dirt is like the mineral part of it, but soil has got all the organic stuff in it. It's got not only organic, dead decaying stuff, which is used as food, but also the live stuff. Good soil is going to have worms in it and bugs in it that help keep the soil loose, for one thing, keep it from packing down, help digest the dead stuff. And it's also going to have a lot of bacteria that are doing the same thing. And that's all part of healthy soil. And when you raise food in healthy soil, you get more nutritious food. And part of what we're trying to do with the farm there is to create some self-sufficiency. So I would just love if I don't have to go to the grocery store at all, hardly. Maybe go like once every couple months to buy this or that. That's what I'd love to see. In fact, this last month we did that. Was like we got to eat some of this food we got stored up. We're not going to the grocery store except for milk because we don't have the dairy cow going yet.
Come on now, come on. What's going on?
Going to the grocery store. That's great. We got all sorts of. We got a lot of fruit trees, and I'm planting 100 more fruit trees this spring. So all different kinds of fruits. What I'm hopefully going to get, and the idea is, not only can we be able to feed ourselves, but maybe sell some of that food, and then share that knowledge of how to grow your own food. Also, that's going to be the whole part of the whole picture there, and sell maybe some meat and eggs and.
That's fantastic. I wish I could be living closer so I could soak up some of those eggs. That it's one of my.
I'll just ship you some dirt. I'll ship you some of our dirt.
Yes.
You can grow stuff in there. You can eat some of it.
Okay. Eating dirt. We're gonna get into that. We're gonna get into eating dirt.
Go ahead and talk about that.
How not to eat dirt too. But one of the things that when you look at good soil.
Yes.
Obviously this is something I'm speaking out of my expertise, but when I did a little research, I get a little better understanding. One of the things that's so important that I've touched on a lot is the microbiome. So the microorganisms that live in and on us and how important they are. And a lot of people realize they're there. And for many people, they think, well, that's dirt, that's germs, that's disease, and we got to wash all that off. And there's some truth that we pick up pathogenic organisms, cholera, tetany. There are some things that we don't really want to have inside our bodies, but it's so important that we get around healthy dirt and we get some of that in our bodies. One of the ways that that happens is a kid basically goes outside and plays in the dirt. If someone's in the park or someone's in their yard and they're kicking up some dirt, they're going to get that in their body. Now, the city dirt isn't going to be the same stuff. You guys are going to have the real dirt. You're going to have chicken poop dirt, cow poop dirt, rooster,
right.
All these different kinds of poop dirt. We can talk about the difference between a rooster, a chicken, and a hen at another time, because that's still a mystery. I'm still figuring that out. Like the bull and the cow and the steer and the calf. And anyway, thank God I got a different way of making a living, right? But I think that it's important for people to know that what they're eating is so much more valuable when it's grown properly. There's a study done about a can of spinach that came out of World War II. They opened it up and they looked at the mineral content, and it was hundreds of times more mineral dense than fresh spinach today. And the obvious reason there is, back when that was canned, that was grown in organic soil, because it's all there was. There wasn't the pesticides to the degree, I'm sure there were some, and herbicides and whatever else that goes into soil. So what a shame it is that you can go to a store right now and get fresh spinach and you don't have the quality of mineral content than what's found in a can that's been sitting around. And one of the questions, of course, was, did the can minerals leach in, and were some of those? And that wasn't the case. The minerals in the can were not. They'd be a different type. So they made sure that that wasn't it. But when you talk about good soil, like you're mentioning, one of the things I want viewers to know is that we sense what's in our intestine through one of the main nerves of our cranium. There's 12 cranial nerves. One of them is called the vagus nerve. That vagus nerve goes down from the base of our skull through our neck and goes into our intestine and reads and calculates the biome and the chemistry of that. And we create a relationship between our mind chemistry, the chemicals made in our mind, and what's made in our intestine. Serotonin is a chemical that we make, and it basically determines your happiness and level of success in life. So if you're born with a lot of serotonin, you're going to be happier, more successful. The studies have been done on this. And if you destroy yourself to the degree where you can't really make a lot of serotonin, you're going to end up in depression and be less successful and less exuberant about life. Some of the antidepressants, if you look them up, are serotonin uptake inhibitors. So they stop you from making serotonin, or they stop you from destroying serotonin that you make. They inhibit the uptake of it. So you're constantly circulating higher levels of serotonin and you feel better because of it. Now, obviously, a pharmaceutical answer like that has a lot of detriments, and I won't get into all that. But if you can have a healthy fruit or vegetable go into your body that's grown in nutrient-dense, healthy soil, the stuff that you're having on your farm, it's going to create that serotonin because it's going to communicate through the vagus nerve, and you're going to be making. Now, you make some serotonin in your intestine. You also make some in your brain. So imagine eating your food like your kids. Your kids are healthy as horses, right? There's really a healthy group of kids, and there's a reason for that. They're outside playing. They're outside doing physical work, and they're eating some of the most amazing food that can be grown in the right soil and the right temperature all around you. So when you talk about doing what you do and getting those soil organisms and getting that body to respond, I mean, it's probably obvious to you that your kids and you are kind of healthier than a lot of other people walking around. Can you see that? I see that.
Yeah, probably, but that microbiome is amazing. What the research on that is coming out, and probably it's been there for a long time. I don't know. You're a lot better at looking at that research than I am. I see stuff that comes across, but and what it can do for health. And a lot of the health professionals that we've heard from stuff, they start with this, they say, fix the gut. That's where things start at. And it is that creating a healthy microbiome that in the gut and actually on your skin too. you know, and you were saying something about, which was amazing to me too, the DNA in the
Yeah, if you took all the DNA of all your cells and you were to hollow out the body, let's say, just look at a normal person's body, all the DNA of all your cells would fill up almost one leg. It wouldn't even fill up the volume of one leg. And all the DNA of all the bacteria in your body would fill up the whole rest of your body. So think about that amazing amount of DNA that's in you that isn't really you. I mean, look how interesting it is to say, okay, this is a liver cell. And you look under a microscope in histology and we saw a liver cell or a heart cell, and we say, okay, that's a different organ because that cell has a similarity. Well, what about another organ that we call the biome? Just because it's not condensed in a fashion, a little ball sitting inside our chest, doesn't mean that we're not affected the same way an organ's affecting us. Our intestinal microflora is another organ. It's another brain. They'll say the intestines are the second brain, the heart, third brain. So these different brains are, what are they doing? Well, they're creating a chemistry. What does a brain do? It records information. It also creates chemicals that communicate with the body to create different moods from different stimuli. So when we're doing all the right things, or most of the right things, we are going to have that enhanced chemistry through the proper number of organisms. There's 1,000 different species of bacteria in our body, 1,000 different species. So it isn't like you can take a probiotic and say, okay, well, that's good. Well, that is good. It's better than nothing. And I always tell people, get a probiotic and write down what's in it. And then take that bottle and then grab another bottle with different probiotics and try to get as many in that you can store by, and then eat fermented foods. And I think on your farm, you're going to have in the air, microorganisms that are going to be that next to get us up to whatever number, because this 1,000 different species isn't a healthy person, but a super healthy person might have 10 times that. We don't know.
And it's amazing to me how loose we are with antibiotics. How easily they're prescribed, and we're putting that into our food and stuff too. The antibiotics into our animals so easily too, and it's really all over the place. And the danger of that to our health. I mean, we don't think about that enough, I don't think.
One of the things, gut inflammation from antibiotics to too much sugar to processed foods, has led to a series. They've seen a really strong correlation to different emotional disorders. I made a simple list: depression, bipolar disorder, OCD, obsessive compulsive disorder, schizophrenia, and autism are all related to the gut flora. In autistic kids, they found 10 times more Clostridium differentialis in their gut than kids that weren't autistic. So we know Clostridium, or C. diff, is a pathological organism. It's 10 times higher. Then the question is why? Maybe because it has so much room to grow, because there aren't healthy bacteria taking up that turf, taking up that space. There's only so much space in there. There's incredible amount of absorptive surface. It's like the size of a tennis court.
Overgrowth.
Right. Yeast, fungi. So you have other issues in there, and this is a newly explored area. I think we're getting better and better at this kind of stuff because we have attention is being paid a lot of times because of autistic children. To have the high number of autistic children right now, and I believe if you look in the Amish culture, there's not a lot of autistic kids, or there's hardly any. And what do they do differently than us? There's a few things, so let's get the science right on this. But certainly one of the things they do is they're not eating processed foods, and they're around a lot of soil organisms.
Well, certainly, I mean, autism is becoming very prevalent, almost an epidemic there. There's so much more of that, and mental health issues are becoming more and more prevalent. And there's got to be a reason there somewhere. There's a lot of, it's multiple factorial, I'm sure, but boy, you got to think about some of the things we're doing with our nutrition. It's got to make a difference. Yeah,
I mean, I just one of my things to tell people is eat every apple you see. Right? Eat every apple you see. You're over someone's house, just take the apple. Don't even ask. Just start eating the apple that you see on the counter. Because if there's one food that's never really been torn apart or destroyed by dietary advice, it's an apple. Right? There are carnivore diets. We can be fussy here, where people can't eat an apple. They have autoimmune diseases and they don't do well with certain foods. I've heard of individuals that if they have a glass of apple cider, eat an apple, they can fall into a depression for 3 months. It's really fascinating. But
well, unfortunately, you also got to watch for the chemicals that were put on an apple.
Sure.
Unfortunately, we're in that era too, you know.
Yeah. I mean, you can clean some of that off, but some of that is, you know, inside that apple as well. But I think it's really crucial that when we look at this, we also explore how this affects our immune system, our mental health as well. But right now, such a hot topic is getting a strong immune system. And touch on that. Touch on some ideas you have that you can tell our listeners, our viewers, to deal with strengthening their own immune systems.
Right. So, you know, like what we already talked about, your gut health. Okay. Mm-hmm. But then there's some lifestyle things, including making sure you get enough sleep, you know, regular sleep, make sure you stay hydrated. Your body needs that. Making sure you're eating well otherwise. Those things are really important. You know, I know for myself, if I ever do get in trouble, it's because I've violated a couple of those things. And then one of the things that we've been doing in our family for our kids and for my patients for a long time is vitamin D and C and zinc, and the vitamin D especially. I mean, and that's something with the virus that I've been pounding home to my patients. You know, talking to them about that whenever I can.
I posted on Facebook multiple articles on vitamin D. You know, it's just 30 years of research we have that vitamin D enhances the immune system for flu viruses. And I don't care if it's this one or the other ones. They do have some things in common. And one of them is that vitamin D is a major factor in severity. To deter it from actually getting you, it works. But the severity that I've seen these graphs that are now coming out on serum vitamin D, like what's in your blood and how severely you end up with COVID-19 is just, it's a direct correlation. And you think about,
I've seen some of that.
You think about who's suffering this condition, people in nursing homes. Well, they don't get out in the sun and they're usually not supplemented with vitamin D. I said right along, when someone goes and gets a COVID test, they should be handed a bottle of vitamin D to take. Government issue, right? We have government issue hand sanitizer. We had our governor was having prisoners make it in prison. I can't see, vitamin D is so cheap compared to anything else, you know, but, you know, it makes you wonder when you follow the money, what's going on. But, you know, getting that, and like you're saying, to me, that's, some of it's mastering the fundamentals, sleep, motion, diet, and also there's some tweaks on it. Stress levels make a difference, right? I think acute stress is important, but chronic stress is gonna
right. That's the difference, right?
Right. That's gonna be that.
Sugar, you know, sugar's immune system depressor, so making sure, and that's part of your old diet thing too.
Mm-hmm. Yeah, like you and I were talking one time about how suffering is necessary, and it sounds kind of insane, but if you don't stress yourself, if you don't push yourself, you can't really get anywhere. Everybody admires somebody that has done something amazing. And usually they've done something amazing because they got disciplined, they worked hard, they stuck to it, they persevered, they pushed themselves. They had a big reason for doing it, and then they did it. And it wasn't easy. So if you seek a life of comfort, I think you're doomed. I think you have to seek a life of doing things that are uncomfortable. Right. Yeah. When I started doing these podcasts and when I started making videos and opening up this an online university we're going to open up soon, they're uncomfortable things. Right. But I could have easily just rested on my laurels, as they say. I'm not even sure what a laurel is, but resting on any success I had. And, you know, that isn't very stimulating. You know, I mentioned other times I had a 101-year-old patient that taught me that if you don't make an ass of yourself once in a while, you're really not going to do very well. Because he wasn't afraid to be dumb. You know, he's a super bright guy, but he wasn't afraid to try something new and not be good at it. You know, I've gotten a kick out of being bad at stuff lately, and then improving upon it. You know, just working at it, taking criticisms, that kind of thing. So you know, that's just, to me, that's part of being healthy. Challenge that body, right? When we go up a 14,000-foot mountain, what do? You know, it's not easy. You know, you were talking earlier about Madison. You know, my daughter.
You should tell that whole Mount Massive story. You know, because there was an example. You know, you and me, had done stuff like that before. But then you have Madison and you have Dr. Brittany Stamer, and what they went through to get there was so much more than what we had to do. And I admired them so much for making that all the way to the top of that. It was amazing.
Yeah. Yeah. If you haven't seen the podcast I've done with Dr. Brittany Stamer, watch that. But I'll tell you briefly
on that podcast. That was wonderful.
It's a good one. And the day before she broke her arm, we didn't know it for sure. She didn't want to get x-rayed. I wanted to have her x-rayed. That didn't come up in the podcast, but she's like, I think I'm fine. And, right after crashing her bike, we got her up and she pretty much said she's climbing the mountain tomorrow. And I'm like, well, you could have a head injury. You could have a lacerated spleen. There's a couple things that we got to be concerned about. We're going to be monitoring you for a while and checking you out. When you and I were there, 2 doctors checking her out, and we realized she was relatively good, but the arm was a little twisted up. And, she doesn't really need the arm to climb the mountain. She's got us if she needs us to help her a little bit. It's not going to be an all-fours thing. It's going to be a 2-legged and occasionally some arm use. And we're going to be there. Madison could help out as well. And your daughter was with us as well. So we did it. She went to the top. So, was that easy for her? Not at all. And for Madison, she's never done anything that physical. She's an athlete. She's in good shape. But, this was something that was outside of her wheelhouse, to be at those altitudes, breathe that air. And
she had a little trouble breathing, wasn't she?
Yeah. Yeah. I mean, she has some asthma. That's something that, I've been challenged by. I've solved it with diet. She's not as strict with her diet as I am. And we, you made the decision to split us into 2 groups, which I think was a great idea. I got up there first with Brittany, and then you came along with Maddie. You paced her nice and slow because we were worried about an afternoon storm coming. And so we got a potential afternoon storm. We have Brittany with maybe a broken arm. Turns out it was, but we didn't know for sure. And then we have Madison with a really challenging respiratory. she's really like breathing heavy. And we made it, and we get to the top, and the emotions were high, to say the least. I went to tears because I don't cry real easy, but it's my daughter, and I saw her push herself at a level I didn't know she could do, and I was so proud of her. And as I know, everyone there was. And then when we had Brittany's arm x-rayed, the same feelings were like, okay, these 2 girls are going to put us to shame. I mean,
they are. They did.
They had to push so much harder than we had to push to get up to the top of that thing. And whether they do it again ever, if we scared them off, or if maybe we might have whetted their appetites, who knows? Maybe they need a couple years to think about it.
But the suffering of that, getting back to that, is the suffering there is it pushed them to a point, and that's what we like to do to ourselves, and I like to do to my kids, so they know that you've done this 14,000 footer, you've climbed this big mountain, you're going to come across small molehills that you're not going to make into big things, because you've done this big thing. Everything else is going to look smaller. The little things are going to look little instead of, and that's why pushing yourself and suffering and going through those things is so important in your development.
100% agree. Like that brings us to one of the topics I want to talk about was tough love. The idea. I think what we did with Madison, especially, and with Brittany maybe a little, she was kind of doing it to herself more, is encouragement, and to a certain degree. And one of my favorite stories of tough love was, you have 6 kids, and one of your sons has Down syndrome, and he's a super high functioning, incredibly lovable guy. And we were on a pontoon boat, and you were a little frustrated that he was fussing about going in the water. I don't think it was super cold, but Minnesota lakes, in July can feel a little bit of a chill in them. And he had a full-on life jacket on, life vest. And you just picked him up and tossed him about, I would estimate 30 feet through the air. And he kerplunked and went down a couple feet and then came up. And of course, he's paddling around. And, before you know it, he was swimming fairly well, still the life jacket on. But, and I'm assuming at this point, he's probably some kind of an advanced swimmer. But it was like this tough love thing. He was kind of doing a little whining, and, that's not your style. We used to joke about, I don't know if you remember the one trip we were on, and maybe, I don't know if this is tough love or just you had an excuse to slap me in the face and you took it. We made a bet. Do you remember this? We made a bet. The first person that whines about anything gets slapped in the face. We're just going to stay positive, stay focused. And I went and took a shower, and the nozzle was drizzling. And I was able to do the shower fairly well, but I came out and I said, that was horrible. The thing drizzles. I kind of, we were staying in kind of a beat up motel of some type.
That was
That
suffering.
was bad. I think I almost died of a mold. I was like inhaling mold the whole night, and I can't handle that. So I ended up. You went in there. You got your Leatherman tool out, unscrewed the thing, knocked a piece of rust out, screwed it back in, and all of a sudden I'm laying in bed, and I hear this amazing shower going, and I'm like, oh, well, I don't know what that is. Maybe the guy next door or something. And you come out all refreshed looking, and you took a piece of rust and you tossed it on my chest. And I said, what the heck's that? He goes, I took it apart. I solved the problem. I took a good shower. And I stood up and said, all right, go ahead, because we had that deal, and you gave me a little slap in the face. Which, you don't remember that? I remember it because, it wasn't pleasant. You got those big mitts on you. So, I'm sure I'll get you back.
Yeah,
but
sure you have.
Maybe that was payback from my deal. But so in your time in doing what you've done, between getting the farm going, being a chiropractor, and a father, and everything else, one of the things that I think everyone should know is that I don't know if you even own a television, and I think you're very well read. You tell me I'm well read, and I like to stay current. I think it's important. I want to be part of the health community, and we don't want to get too left behind by these youngsters coming up with their smart ideas. We got to stay on board here and stay current. Give us some ideas of how you stay current. What do you do? Are you a YouTube guy? Are you you get ideas from books from patients? Do you research online? How do you stay current?
Well, mainly I have a couple good friends that keep sending me stuff and keep me up to date, and I talk to them like you.
Okay.
No, but there's some emails I get. If I hit something, there's some publications I get. It's just coming across stuff. I'm like a lot of people. You get the emails and it follows through to something else, and I'm getting interested there, and pretty soon, I'm spending an hour or two on the internet reading about this or that. So I got a lot of information that way. And some information, sometimes I get information by either my patients give me information, or they ask me a question and I got to go find an answer.
Right.
So the patient challenges me there too.
I think that's really important that, that I remember Dr. Sweary telling us, you don't have to know everything a patient asks you. You should know the basics, and, but the thing you should do is know by the next time you see them. Yeah. And that's something I try to do. I make a pocket note, stick it in my pocket, and I tell them, I'm not sure about that, but when I see you next time, because you see, as a chiropractor, you see people multiple times to get their spine mechanically sound. I said, by the next time I see you, I'm going to know the answer to that. So I'll look it up. And that's just amazing. Sometimes you go down a rabbit hole on stuff, and you're like, pretty soon you're starting to think the earth is flat. But at the same time, you're learning a lot. Sometimes I answer the question and then I'm like, well, this is really wild. I can't believe this is going on. Before you know it,
how would you describe Dr. Sweary?
The man, he's one of those people that, you're just thankful for having known. I don't know what to say. I mean, this is a man who is spiritually developed to a point that he's humbling to be around. He's one of the brightest people I've ever known. I think he's started multiple businesses, donated, I want to say, millions of dollars to the school. I mean, he's a success on so many levels, and his humility is overwhelming. Like, if you're standing next to him and you drop something, he's more likely to get down there, pick it up, and hand it to you. And this guy is your master at almost everything. To this point, I don't think I've outdone him or matched or am his equal at any level. The man is hardworking, intelligent, kind. He's one of the most amazing people I ever met. And I don't know what else to say. Just he's incredible.
I agree. You know what? I think you're this generation's Dr. Sweary. I really do.
Oh, please,
I think
please.
You're up at that level. I'm serious. You're up at that level with your knowledge, your concern for people, and your compassion for people. And that's what comes across with Dr. Sweary, and that's what comes across with you, with your patients and stuff, I'm sure.
I appreciate that compliment, Bill, but man, that is something to live up to. I might have to live a couple lifetimes to reach what he did. He did in one.
He is an amazing man. He really is. But you're getting up there, man. I'm telling you.
Well, I remember he gave our graduation commencement speech and said something that I think is what we were just kind of talking about. He said, "You've gone through this institution and we are your teachers. We've taught you right and wrong. We've taught you how to do all this stuff." He goes, "And now you think you're leaving your teachers." And he goes, "Well, you're leaving one set of teachers and you're about to incorporate, you start to involve yourself in a whole nother set of teachers, your patients."
Mm,
And I thought, boy, is
true.
that good, right? I mean, because how much have you learned from your patients? It doesn't even matter if they come in and teach you something new, like they read a book and talked about it, or had a new concept or new exercise or a stretch. How about when they just have something that's challenging for you to learn because you
Mm,
just don't know, and then you go and you have to learn. So they just taught you how to do this. It can be humbling when someone doesn't get better, but what do you do about that? You turn over every stone you can to get them better. And that's something that
yep.
when I'm challenged at work, I think, this is something that, here's my new teacher today. And it could be the most miserable, angry, sullen, destructive human being that's walked into your office that wants to ruin your day. Your staff is in tears. They don't want to pay their bill. They tell your office looks shabby and you don't know what you're doing. And it could be one of these horrible people. But what can you learn from that? Well, you can learn tolerance. You can learn communication,
Yeah.
right? Because you got to be able to, and you can learn to be tactful. There's all kinds of lessons to be learned when someone isn't the greatest and easiest person to be around. I try to not let anybody throw my game. If someone's going to come in and be kind of nasty, I'll smile at them and say, "Well, I appreciate your opinion on that. I think you're partially right. We could have done that better, but here's what we're dealing with today." Like
Mhm.
waiting time is one of the things I struggle with because, as you can tell, I'm chatty. So I get in the room with someone, and before you know it, I'm in there for a while, and they start stacking people in the waiting room, and everyone gets a little frustrated. They have appointments to go to, and I made them wait too long, and it's really frustrating for me. But I don't like to leave the room until I feel like I made a difference in that person today. And sometimes that's a problem. And a person will yell at me like, bah, bah, bah. And one time, a tough love thing I said to one woman was, if your grandmother was in here and she was showing the signs of a stroke or some serious health problem, would you want me to just kind of make sure I kicked her out the door? Or would you want me to really figure out what's going on with her? And she's like, yeah, well, she hemmed and hawed a little bit. And I said, and if I put that much time aside for every visit, I would not be able to feed my children. Right. But so I have to split the difference. I have to split. And sometimes it comes out in the wash because the next four people had nothing to say today and they're doing fantastic. And it's a simple adjustment. But then the next one's going through divorce. Their dog died. Their child just got diagnosed with something horrible. And there's going to be a little more time in those visits. So that's just, and that's the kind of relationship I want to have with my patients. I know that's the kind of relationship you have. I mean, in a small town, it's got to be a different dynamic to some degree, but at the same time, Buffalo, I always say Buffalo, New York is one of the biggest small towns you can possibly have. It struggles to be a city and it loves to be a small town.
Well, how many times are you treating multiple generations in a family? Do you do quite a
All
bit
the
of
time.
that?
All the time. Yeah, it's
Yeah.
fantastic.
And I love that privilege, and that's part of why being a chiropractor is so great is because first of all, we talked about how you get to know the patient, you get to develop that relationship with people. And now that is so much important. And it's so important in the healing process because you know what they're doing better. You're able to communicate at that. And there's so much, energy exchange that happens there. And I know another doctor that gets behind sometimes is my wife, Dr. Christie. And you guys are a lot alike in that how much you care about your patients. You
I don't know
know,
if I have the listening skills of Christy. I've said to you before, when she actually sits inside your head and just patiently looks at you, it's an
she's good
amazing
at that.
thing. She's an amazing listener, and you are, and I think that's even more interesting because usually there's a talker and a quiet person in a relationship. You guys are both capable of speaking. Obviously, but you're both capable of doing both, which is, I think, a rare trait. Some people just like to hear themselves talk, which I tend to err on. I think I don't really think I like to hear myself talk, but I find myself going on sometimes, and I try to be a good listener. But you guys have that mastered.
Well, she especially is. My patients know I'm the mean one. She's the nice one. I tell them that. I mean, I admit it. No use hiding it. She's the nice one. I'm the mean one. And it's sometimes
Well,
we talk about that tough love thing where we went down that road a little bit. But when you have that relationship and that trust built up over time with patients, where you've seen, the grandma, you've seen their kids, and when you have to tell them something hard, something that they don't want to hear, they're going to take it from you a lot better, and they're more likely to follow through because they know that it is tough love. It's, you're doing this, and even when I have to maybe work on a person a little bit harder than they want me to, then they're really like, okay, I know this is going to hurt a little bit, but this is for your benefit, and they trust that,
Yeah. One of the things, getting along with talk about generations, is the treatment of children in chiropractic. Both of our wives, partners, fellow chiropractors in our practice, have dedicated their time and energy to really working with children. My wife and I taught natural childbirth classes, and had our babies naturally, and that respect for nature that you and I have. Treating children, to some people seems odd even today, which it always shocks me because, if you have a spine and you have a stressful life, whether that be how you came through the birth canal or the tumbles you've taken as a child, to get that spine mobile and corrected naturally, meaning no drugs or surgery, is such an important thing. And I can't stress enough for parents to find a chiropractor that's comfortable treating children, which is most of us, and get that child involved in that. Realize that spine, although it's cartilage still, it hasn't ossified. The techniques we have are perfect for that. I have a handheld tool called an activator, which a lot of people know about. I use that on a lot of the little squirmy ones. And then as they get a little bit older and a little stiffer, I start using more manual technique. I use thumb pressure, that kind of thing. So talk to me about, your treatment of children, and, and as well as Dr. Christie's.
Well, first of all, treating children really starts before they're even born, right? With treating their mother and making sure that their mother, well, if she's pregnant, even before she's getting pregnant, because that can make a big difference, is healthy, is doing the nutrition things, right? Making sure they're getting adjusted so that when they go into labor, it's not like a really hard labor, because there's been good studies showing that, women that are adjusted, and it makes sense biomechanically, and you can explain this better than me, but how if things are lined up right, the pelvis is going to open up, that birth is going to be much easier for the woman, for the baby, and adjusting that baby right after they're born or as soon as you can afterwards, because I don't know about you, but my kids were adjusted like minutes after they're born, because it's a tough process on a baby too. They're getting their head squished through this little canal. So as soon as my kids were born, they were getting adjusted.
Yeah, exactly. I believe it's hundreds of pounds of pressure to come through the birth canal. But just like an egg, if you take an egg and you wrap your hand around it and squeeze it, it's really hard to crack the egg because of the shape of it. It just transmits the force in such an interesting way. And a baby's head is similar to that in the way it has to reshape itself, but it comes through the birth canal. And it's so important, I think, to adjust children. On that note, we talk about non-traditional chiropractic treatments, the different types of treatments that we have. Most people know about the snap crackling standard style that's, from the 1895 and still practiced today. And it's the majority of what I do. I practice 6 different techniques. Give us some ideas of a technique that maybe our viewers and our listeners wouldn't really know about. Give it a name and maybe describe what it is. What's one that you do that isn't the everyday thing?
Well, yeah, right. The techniques, a lot of those techniques, some of those were taught in school, but I was thinking about this, probably 80% of what I use is stuff I've learned after we got out of school, maybe even more than that.
Right.
But, and one of the techniques that my wife, Dr. Christie, uses is applied kinesiology, which is more of a diagnostic thing, but she uses that a lot in kids and all of her patients. And that's kind of an energy technique for diagnostics. But there's a wide range of, I guess what I call aggressiveness in the techniques. So you have your activator. We have something called a variable adjuster, which is also a tool, but it's an electric tool. I call it the jackhammer because it kind of gives a little thump. You have really soft tissue techniques, but also the low force techniques, cranial sacral, which I don't know a lot about that. I know your wife and Think knows a lot more about that than I have any idea about. And then there's the standard stuff. But there's also, we're not limited to actually with the technique, but it's some of the exchange of sometimes the advice we give is more important than anything else too. It's all us putting all that stuff together.
Yeah, I think one of the things that everybody should take seriously is that the term doctor means teacher. And I know you know that, and I know a lot of people might forget that, but I've been asked, and I said this on another podcast too, why are you a doctor? I've had patients ask me, how are you a doctor? Because I'm not in a hospital, I'm not prescribing drugs, and I'm not doing surgeries. So, the answer to that, of course, is we are teachers. We instruct our patients on how to live a more natural life. You may actually have farming advice for some of the patients that come in your office. I wouldn't be surprised. You're like, got to dig a little deeper. You got to, throw some more chicken poop on that. But for me, it's really going to be, I just take it seriously that my job is to inform people, get them back on center, get them back on track. And I think, if you go to a doctor of any type, and they don't really get involved too much in your exercise routine, your emotional stress, and what you're ingesting, what is your plan for ingesting? You really don't have a doctor, you have a drug salesman. And that's something that I think I've said before, but I think it bears repeating, because we've said in other conversations that medical doctors have a very difficult job. They don't have that advantage of seeing that patient multiple times in the same week to complete stories. They're stuck, like you said about your brother-in-law, having to fulfill kind of a cookbook type of
right. They have the protocols and
and those aren't don't leave any room for the emotional and the personal relationship that you can develop with your patients. That we have that advantage. We have such an advantage of getting to know people at such a high level, and everyone benefits from that. When you have a relationship with your patient, not just a doctor patient relationship, but something a little deeper than that. I don't know what you would call it. I mean, being friendly would be an understatement on that, because you know them better than that. Everybody benefits. You're going to be a better diagnostician. They're going to get a more detailed treatment protocol and routine. And I think in a small town, that might even be magnified. I know in Buffalo, like I said earlier, is the biggest small town / city you could possibly have. There's a lot of that closeness, there. And I think every chiropractor has that advantage, and that's something that a lot of people don't realize. Everyone should have a chiropractor in their life. I always tell people everyone needs to know one good chiropractor. I mean, if you don't, find someone that you relate to. And it isn't like one chiropractor is necessarily bad. Sometimes it's just not the person for you. Their technique is not for you, or their personality. They don't communicate. Some people just don't have that same vibe as you do. But when you have that and you feel like you can share with somebody, some of the more intimate things that might help you become healthier, you can take advantage of it, right?
Yeah. It is. That's what makes being a chiropractor fun, is that we're able to do that. And sometimes I come to work grumpy, and after I'm at work for half hour, my patients they do that for me too. I mean, it's going both ways. They're good for me.
Absolutely.
I'm good for them. And one of the things we're talking a little bit about with children, a lot of times what we're treating on children, the complaints we're treating aren't musculoskeletal. And they're coming in because they have earache. They're coming in because they're fussy. They're coming in because the bowels aren't moving. And these are the things we're treating most of the time in kids. It's actually non-musculoskeletal stuff most of the time. They're not coming in with my back hurts. They're coming in with the kid's driving me crazy. He's not sleeping. He's bouncing around all the time. And these are the things. And sometimes it's just a simple, they just need to be lined up better, adjusted better, get the energy flowing better. Sometimes it's okay. We need to look at what they're eating and all this other stuff too.
Right. Some gentle reminders that, due to convenience, maybe this child's ingesting too much processed food, too much sugar,
something we talked about earlier.
It's not easy to be a parent. It's the toughest job I've ever done. And I never want to criticize people's parenting skills. I think most people are doing their best with it, but sometimes a gentle reminder that, let's get this kid on some more whole food. let's try this and let's try this. Well, he makes a face. Well, give him less options. Stop buying that stuff. Don't have it in the house.
Tough love. Tough love.
Yeah. Yeah. I would have said this earlier, but yeah. Yeah. Back to that. My kids didn't always want to eat the stuff that we prepared for them, but now they're some of the most healthy eating people I know, because we developed those habits and they saw the value. And when they did get sick, they would look and go, okay, I know why. Just like you said earlier, you sometimes when you're sick with something, whether it's a cold or a flu or a sore throat, you kind of say, yep, I know what I did wrong, and it's something usually in the fundamentals. You did something, you didn't master the fundamentals, your water intake, your sleep, something was off like that, right?
Mm-hmm.
But anyway, so yeah, I think we covered a lot today. I think it's interesting that you have a farm and you're a chiropractor. Like you said, you went full circle. You started out as a farm boy and you're kind of doing it again, but you went out and did something that's challenging to do. You got 8 years of chiropractic, 8 years of education, training in chiropractic, started a practice, built it up, and now you get to enjoy, the full lifestyle. You're living the chiropractic lifestyle, which is something that other people don't know much about. And maybe touch on that. How would you define the chiropractic lifestyle? What is it? Because I say that to people and I flesh it out, but how do you get someone to be in the chiropractic lifestyle? It's a term we throw around.
That's a real good question. It is the whole lifestyle. It's not just I get adjusted every now and then on a regular basis. It's not, okay, yeah, I get adjusted once a week and that's something I do because I'm a chiropractor. I know that that's important. Yeah, I eat better, but it's the chiropractic lifestyle is eating well, it's knowing about health, but it's also the emotional and spiritual and also that continuous growth that we've talked about. It's the whole picture. It's the holistic idea. It's not just getting adjusted. And again, you could do that much better.
100%. No. That's a great definition, is to look at the entire situation of your life. Managing the stress, all that kind of relationships. Brittany Stamer mentioned a community. I really love that one. Do you have a community? Do you have support around you? Many times I give people advice on dietary and exercise advice, and there's no one supporting them. There's no one at home that encourages that. Everyone else might be living kind of a really unhealthy existence, but they haven't become symptomatic in any big way yet. Or one member of the family now is suffering from the lifestyle, and there's not a lot of recognition that needs to be changed immediately. A lot of times until somebody really gets a wake-up call, they're not really going to do much, and I try to get people to say, that over time is going to not going to be good. We know, I've observed it over and over again. So, get that.
That's a good point.
But yeah, the chiropractic lifestyle, I think it's a great term. I think it needs to be maybe more promoted. A lot of people would
agree.
A lot of people living healthy lives are already living it. But I think we can. That's something we should probably put in it as a package. You can write a book probably called the Chiropractic Lifestyle. Any young chiropractors out there want to write a book? Write one called the Chiropractic Lifestyle. I think that'd be a good one. If you don't do it soon, I'm going to end up doing it. But yeah, so we talked today about soil organisms. We talked about the difference between medicine and chiropractic a little bit, that we have an advantage with our patients over getting to know them because of multiple visits associated. How being a chiropractor is truly a doctor because it's truly a teacher. I love the microbiome. I think everybody should do more reading about microbiome. There's great YouTube videos on there. Maybe we'll throw in the links on this about understanding the value of organisms. The book by Josh Axe, chiropractor that I have a lot of respect for, called Eat Dirt. And how you can get dirt in your body simply by playing outside, having a dog, just avoiding antibiotics because they kill off so many good things.
Right.
And then when you do get them in there, they live in there, right? And that's something I know you live because you're surrounded by poop, right? I mean, you're surrounded
Exactly.
by animals,
Just getting
right?
outside, camping, you can't avoid eating some dirt when you're going camping. It's just part of the thing. So get outside, even if you're going for a walk, get outside, it's gonna get to you. You can't get away from it.
I think we're developing as a culture and understanding from how fresh air is good. My grandmother always said that. My grandmother used to joke that you got to eat a bushel of dirt before you're dead. So she was ahead of her time, obviously. Always was. Amazing woman. And how you can sunshine and vitamin D.
Yeah.
And now, obviously, soil organisms, right? So we're going to lay in the dirt and get some sun at the same time. Maybe roll around and tan and cover ourselves in some filth, right? But all right. So anything else you want to tell our viewers, our listeners? Any advice, parting words, magical remedies to cure in all ails of man?
You know, and I know we touched on this some, but it's that whole emotional and spiritual well-being too is such an important part of it. And you've touched on the science. I know in some of your other videos about that. I know you and Fred, Dr. Fred Cleary, talked a little bit about that stuff too. But you know, it's part of your lifestyle. Should be taking some time to read, to pray, to what we call meditate, to learn something new. You know, if it can't just be getting up and plowing through a day, because you got to connect to whether you call it the inner self, connect to God, connect to, and connect to other people. Like we said, how important that community is. We said how important that you know, when we're connecting to our family, connect to our patients, there's kind of energy that flows there that you got to be. I don't know how to describe it.
But you make a good point, and if anything, you tell me that I live a life of growth and everything else. You live a life of spiritual development that I don't know too many people that live at the level you did, especially at the age you were doing it. I mean, you were, I don't know, 22, 24 years old when I first met you, and you were like, you know, you were like living with like a, I want to say like a Christ or a Buddha or a Krishna, because you had, honestly, you know that's true. Don't deny it. You know that's true. I was living the average life, morally, ethically, and value-wise of somebody that age, maybe a little bit better than average. But your spiritual presence in my life at that age actually made me go, wow, that guy's got it together. My life is still a little wild. I can improve on that. And you were a major factor in me reading the Bible, in becoming, searching more spiritually than I had before, because you're like an encyclopedia when it comes to that stuff. And your kids are so fortunate to be around somebody that has that kind of solid spiritual base. And you never steer off the rails. I mean, outside of running over a varmint with the car on purpose once in a while, that's a whole nother podcast, how you hunt with a 75 Impala.
74.
Yeah. So anyway, my hat's off to you for being put together spiritually in a time when I wasn't doing horrible things, but I mean,
no, you weren't. No,
I'm not saying that, but I was definitely not in a place where you were light years ahead of all of us. And I think everybody, including a couple of girls that you dated, were really in awe of the fact that how you lived your life. And we won't go any further on that.
But you know, there's selfish reasons for that, and that's why it comes back to overall health. And there's studies. We're men of science. This has been proven to science. If you have faith, if you have a trust in something other than yourself, you're going to have more joy. You're going to have a more healthful life. You're going to live longer. You're going to rate your life as being more satisfying. Your relationships are going to be better. It's all part of the whole picture. So there's a lot of selfish reasons to do that.
Very good point. Very good point, Bill. Yeah, we're not supposed to be carrying the burden of the entire world. That's not our job as these little humans that we are. You know, that's how I look at it. We should solve what we can solve and give the rest away. All right, sir. Well, thank you. I appreciate the time we spent. This is
my pleasure.
Great conversation. It's a great conversation. I apprate everything you showed us today. We'll probably do another podcast with you in the future because there's so many areas we touched on that we could take each one of these and go on forever about.
I want to do a podcast, but with more stories about you. That's what I want to do.
Well, hopefully that if we do that, it would entertain everybody.
It'll be entertaining for sure.
Okay, all right. We'll definitely consider that. We'll see if people want to hear some of my original stories. Anyway, all right. It's Dr. Bill Mettler today on our podcast, and I appreciate everybody. Please, subscribe to our channel and give us some thumbs up and give us some commentary. We'll try to throw some links on here about soil organisms, and maybe when Bill gets his business together on the consulting people and how to have, sustainable farm.
Backyard farm. I'm gonna get it going. Heaven's Backyard Farm is what it's called.
Whose backyard farm?
Heaven's Backyard Farm.
Ah, that's awesome. All right.
I got a website, heavensbackyardfarm.com.
Oh, you already have it.
On it, but I got it.
Well, it's a start. That's how things start.
Yeah.
All right, sir. You take it easy. Have a great day. You got it.